faculty in the department, and it's my pleasure to welcome Dr. Veena Singla, who is a longtime colleague and a friend of mine. We've done a lot of work on both policy-driven science around toxics in the indoor environment, as well as research translation. And this year, she's also kind of joining the Agents of Change and Environmental Justice program as an associate director to really help with our policy translation aspects of our training. She is a senior scientist at the Healthy People and Thriving Communities program at Natural Resources Defense Council, where she aims to create healthier indoor environments by limiting the toxic use of chemicals in the built environment and everyday products. Veena specializes in the communication of complex scientific information at the intersection of research and policy. And I know that's been a theme of something that we're seeking to improve on in this department. And we talked a lot about that with Peggy Shepard and others this week. And Veena has testified in front of many authoritative decision-making bodies, including the Consumer Product Safety Commission, the Alaska State Legislature, and the San Francisco Board of Supervisors. And she currently serves on the Scientific Guidance Panel for Biomonitoring California and the Board of Directors for Clean Production Action. And Veena was previously the Associate Director of Science and Policy at the Program on Reproductive Health and the Environment at UCSF. So I will let her take it from here. Thank you.
Great. Thank you so much, Ami, and thanks to the Center for hosting me today, and to Carolina for arranging a fantastic day. It's like playing three-dimensional chess, coordinating all these schedules, so I really appreciate it. And I'm really delighted to be here today to talk to you about this important topic. Now it doesn't want to work. Perfect, thank you. So I'm going to tell you a little bit about NRDC and then talk about different lenses on affordable housing from a climate perspective, from a health perspective, and how I'm trying to bridge these perspectives in policy. So NRDC is an international nonprofit that employs scientists, lawyers, and policy advocates to advance evidence-based policies to protect human health and the environment. We have a staff of about 700 and offices across the US and in Beijing, China. Our headquarters are right here in New York City, and I'm based in San Francisco, California. We work on a variety of critical issues, including climate change and clean energy, and environmental health, where I focus on healthier, affordable housing. So we can think about affordable housing through different lenses. It's part of the built environment. It's a contributor to climate change, and it's integral to the health of residents. So let's start by taking a look at the intersection of buildings and climate. Building operations are a major contributor to greenhouse gas emissions. If we look globally, it makes up about 28% of total greenhouse gas emissions. And it can be a lot more depending on the place. So if we look specifically at New York City, we can see that building operations account for about 66% of New York City's total greenhouse gas emissions. And these emissions come from burning fossil fuels in buildings to cook and to power space and water heating systems. And then the emissions also come from generating the power needed to run other building systems like electricity for the lighting systems and for air conditioning. Governments are moving forward with building decarbonization to address building greenhouse gas emissions. What is building decarbonization? It consists of three main pieces. So the first part is all the electricity used to power buildings should come from renewable sources. So getting the power grid off of fossil fuel generated power and moving to renewable sources. The second piece is making our buildings more energy efficient, so they use less, they need less electricity or power in the first place. A really basic energy efficiency measure is weatherization, where you're better insulating and sealing up the building envelope, or switching out lighting to more efficient LED bulbs. And then the final piece is electrification, where we're removing fossil fuel burning appliances from the building and replacing them with electric versions. So for example, removing a furnace that burns natural gas and replacing it with a heat pump version, or replacing a gas stove with an induction stove. So this is the idea of building decarbonization, and I'll just put a pin in this. We'll come back to it, and I'll shift for a moment to looking at the intersection of buildings and health. So we spend a lot of time inside. In the US, on average about 90%, whether we're at home, at work, at school, at leisure. And you know, I'd say in the pandemic, it was closer to 100% time for me. And certain subpopulations like babies and people over 65 spend more time indoors. Now, for all of this time we're inside, we want good indoor environmental quality that supports health, comfort, and well-being. And indoor environmental quality is made up of many interacting factors. So for example, ventilation, the noise levels, the temperature inside, how much energy the building is using, the presence of indoor contaminants, the presence of outdoor contaminants that infiltrated to the inside, moisture and wetness, the presence of pests like mold, insects, or rodents, and activity patterns inside like smoking or cooking. And these factors are very interrelated. They're not independent. So, you know, trying to maintain a cooler or warmer temperature will affect building energy usage, for example. So while good indoor environmental quality supports health and well-being, on the other hand, we know that poor indoor environmental quality contributes to health disparities. So we see large asthma disparities in children by race and income. You can see in this infographic, Black children have almost twice the asthma rate compared to white children. And we understand that poor housing quality is one of the contributors to these disparities that we see. And in particular, factors like the presence of mold, moisture, pests and pesticide use, extreme indoor temperatures, and indoor contaminants. So if we're thinking about trying to address, reduce, and remove these health disparities, it's really critical to address housing quality as one of the drivers of these disparities. How could we go about doing that? Well, as Professor Kimberly Crenshaw said, you can't change outcomes without understanding how they came about. If we want to change housing quality disparities, we need to understand what created the patterns that we're seeing today. So what shapes housing quality? There's intersecting factors and systems that range from individual factors like smoking, to the family level, to building level factors like is the building well insulated? And then farther out, neighborhood and community level factors, like is the building near a highway or another polluting source? And then at the highest kind of macro level, there's socioeconomic, policy, and historical factors. And today I want to focus on a few examples of policy factors that specifically reflect systemic and institutional racism that has significantly influenced housing quality and contributed to the disparities that we see today. Taking a look at outdoor contaminants, the outdoor contaminants that infiltrate into the home are an important part of indoor environmental quality. So here we're going to be looking at a kind of complicated graph that shows data from the Pollution and Prejudice Project at California Environmental Protection Agency. So along the bottom here, we're going to be looking at the Cal EnviroScreen score, and Cal EnviroScreen is an index that combines multiple indicators of pollution burden, like air pollution levels and pesticide use, with indicators of population vulnerability, like race and income level, and bundles it together into this average score. And a higher score reflects increasing disadvantage, so more pollution, more population vulnerability. So we're going to be looking at this Cal EnviroScreen score for different cities in California. And the black line, that vertical black line, is going to be the average for the city as a whole. And then we're going to see some different colored dots that are going to be a breakdown of neighborhoods within that city, using the geographies as determined by the Homeowners Loan Corporation in the 1930s. So this is the green to red dots that are shown in the legend, with green being rated the best, red being rated the worst. And this is a policy driven by racism known as redlining. So we'll see the Cal EnviroScreen scores broken down by those neighborhood geographies. So here's what it looks like for San Francisco. You can see the average score, and then the score by those neighborhood ratings. And the red line neighborhoods have, on average, higher Cal EnviroScreen scores, reflecting a higher pollution burden, higher population vulnerability. We can take a look at San Diego and see the same pattern. So on average, San Diego has a worse Cal EnviroScreen score than San Francisco, and that pattern still holds, with the red line neighborhoods having the worst overall within the city of San Diego. Oops, hit the wrong button. We can see the same thing for Oakland, San Jose, LA, Sacramento, Stockton, Fresno, where we see the cities have, on average, worse Cal EnviroScreen scores, and the same pattern of the red line neighborhoods having the worst within the city. So the redlining from the 1930s determines that pollution burden today. And in general, greater outdoor pollution means greater indoor pollution when contaminants migrate inside. Now, these kinds of policies have driven other indoor hazards as well, with these racist policies enforcing residential segregation and keeping BIPOC communities in older housing, which continues to deteriorate as a result of disinvestment of public money. So overall, we see a disproportionate presence of hazards like lead, mold, asbestos, structural deficiencies like leaky roofs in BIPOC and low-income communities. And this report from the Green and Healthy Homes Initiative estimated that on average, when looking at a building in a BIPOC or low-income community, that you need about $50,000 worth of work that needs to be done before you could even start with any of the building energy efficiency or electrification work. So this is sort of the pre-electrification work that needs to be done. Now, these physical building conditions are another important factor contributing to what's known as the energy burden and disparities in that. So energy burden is the percent of household income spent on energy costs, and the median nationally is about 3%, and in general, 6% is considered a detrimental energy burden, where households are starting to have to make choices like, do we pay our utility bills or do we buy food? And above 6% is considered severely energy burdened. So we're going to be looking at the median percent energy burden for different subpopulations nationally and in New York City. So we can see for the non-low income population, a low energy burden. Low income nationally has a much higher median energy burden, with low income in New York City being on average even a little bit higher. And we can see these disparities by race as well, with Black and Native American people having higher energy burdens, and also by building typology. So looking at non-low income multifamily with low income multifamily and low income multifamily in New York City, we see these significant disparities in the energy burden. And as I mentioned, one of the key contributing factors is the physical building condition. So many of these buildings might have poor insulation and air sealing. And in order to maintain a comfortable temperature, whether it's keeping it warm in the winter or cool in the summer, requires a lot more energy when there's a lot of infiltration from the outside. On top of that, if the appliance itself is old and inefficient, like an old and inefficient air conditioner, it uses a lot more energy. So these factors could contribute to the disparities that we see here. And ideally, these buildings could receive energy efficiency upgrades to help address the physical building conditions that are driving these burdens. But when we look at energy efficiency programs, we see another factor that's contributing to these disparities, where funding for multifamily energy efficiency programs is not proportional. So here we're going to be looking at, in the light blue, the percent of households in multifamily buildings, these different cities across the US, and then the percent of spending from ratepayer funded energy efficiency programs on multifamily buildings. So ratepayer programs are programs where everyone who's a customer of that utility pays fees that fund these programs. So all ratepayers are funding these energy efficiency programs. And what we can see overall is that multifamily programs are not receiving the fair share of funding for energy efficiency. So in New York, for example, over 35% of households reside in multifamily buildings, but there's only a few percent of spending that's serving the multifamily building market. So and there's a few factors at play here. Across these cities, 80 to 95% of residents in multifamily buildings are renters. So the funding is favoring homeowners and single family buildings over renters, who are also disproportionately BIPOC, and residents in multifamily buildings are also disproportionately low income. So all ratepayers are paying into these programs, but not all ratepayers are being equally served. And it's another form of disinvestment when you see this this disproportionate favoring of homeowners and single family buildings for funding of these programs. One additional layer is even if the program exists, it may not be doing the most impactful intervention that would reduce building energy usage and tenant costs. So we looked at multifamily energy efficiency programs that serve low-income housing in 5 different states. And what we found is that these programs are not targeting some of the most basic energy efficiency interventions. So I mentioned weatherization before, right? This is where you address the building envelope, add insulation, add air sealing so that the building is better able to hold its internal temperature. And what we found is that this kind of basic weatherization was not common in multifamily programs. And either the measures weren't allowed at all, or if they were allowed, they weren't sufficiently funded in the program to allow building owners to actually implement those measures. And we also found that they're technically doing this type of intervention in a multifamily building is more challenging than in a single family building because it's air sealing a building where there's multiple units requires in-unit access. So especially if the building is occupied, it can be a little bit more challenging. And there was a lack of technical support to help building owners overcome some of these challenges to get these interventions done. So that's a brief look at some of the systemic factors driven by racist policies and practices that have contributed to the housing quality disparities that we see today. Now let's look at the intersection of all 3 of these areas, kind of buildings, climate, and health, and some of the opportunities and challenges I'm seeing moving forward. So I think a huge opportunity is that there's a really great potential for building level interventions to have positive health impacts and address health disparities. Here's just one example of this study. It was a 1-year intervention study in King County, Washington. They had about 40 low-income diverse households in multifamily, duplex, and single-family buildings. And all the families had children with poorly controlled asthma. So that's the light blue bar you see there with the 100% with poorly controlled asthma. And then they did 2 interventions. One was an in-home program, was a trained health worker that goes into the home, does education, and talks about removing asthma triggers like old carpeting. And the second intervention was the same program, but also included weatherization of the building itself. And what you can see is that both interventions had significant impacts, with the in-home program reducing the percent with poorly controlled asthma, but about half. And then adding that weatherization intervention, we saw an even greater effect, reducing that percentage. So this is great. However, the challenge is that decarbonization upgrades don't uniformly have positive impacts on indoor environmental quality. For example, if we look at electrification and moving gas to electric appliances, if you switch out a gas stove for an electric or induction stove, you'll reduce indoor pollution related to that gas stove. However, you may also increase electricity bills and overall utility bills if now the appliances are using more electricity and that's more costly. So, and this would be untenable for a tenant or resident that's already energy burdened. If we look at that basic energy efficiency intervention, right, the building envelope improvements, we can see good benefits of reducing infiltration of pollutants from the outside, reducing extreme indoor temperatures. But if you tighten and seal up that building envelope without attention to adequate ventilation, you can actually trap indoor pollutants inside and increase indoor pollutant levels. So what this tells us is that focusing on building decarbonization alone does not necessarily deliver better indoor environmental quality or address the long-standing housing quality disparities that we see in the affordable sector. So we need to think a little bit bigger. when we want to advance health equity, we really have to support comprehensive upgrades that are going to hit the sweet spot of multiple priorities. We want to reduce building greenhouse gas emissions, but also invest public money in addressing these longstanding quality disparities, and have upgrades and be ensured to improve indoor environmental quality in the end. So I wanted to share some examples of how we're working with partners in California towards some of these more comprehensive policies. So there's, first of all, there's this unprecedented opportunity that we have right now, also with the Inflation Reduction Act, and investing millions into the building sector focused on building decarbonization. Some of this is specifically earmarked for programs in low and middle income communities. And where we are with this now is the federal agencies are writing the rules and regulations and guidelines for programs, and states and tribes will submit applications to administer the funding. And states and tribes have to develop these plans. And it's really critical that this idea of kind of comprehensive building upgrades that can address some of the health and safety hazards is a part of the plan, so that this federal money can support more comprehensive upgrades and community priorities. Okay, so now on to California. Here's 3 reports from our partners that highlight priorities from a community perspective on building decarbonization. And what we see is that communities want an inclusive process with a seat at the table so that they can directly inform and help in the development of policies that are impacting them and their communities. They want upgrades to result in healthier homes and climate resilience, in California in particular, wildfires being a big problem, and related power outages. They want upgrades to decrease costs, especially for tenants and families that are already energy burdened, and to support local workforce development with family sustaining wages for jobs and a path to careers in the green job industry, not just, the kind of short-term job. It's also really important that there be strong protections in place for tenants with these building decarbonization upgrades so that they don't drive displacement or gentrification. And finally, communities don't want to be left out or behind of this transition. They're really excited about living in a climate-friendly home that's healthier, especially, and don't want to be left stranded on an increasingly expensive gas system as other homes and buildings are moved off of gas. So during the COVID pandemic, we worked with partners to pass a kind of suite of comprehensive policies in Los Angeles and at the California state level. So what the package included was a suspension of utility shutoffs, first of all, stop power and water shutoffs, a big chunk of aid to address utility debt and arrears, and then the establishment of specific programs that would address some of the root causes of high energy use and utility debt. So this home energy improvement program and the comprehensive affordable multifamily retrofit program. So these are targeting the low income and multifamily sector. And I'll tell you a little bit more about the multifamily program. so is already targeted to multifamily and low income specifically. And on top of that, the buildings should also be located in a disadvantaged community. So that's the disadvantaged community language is in California law related to that Cal EnviroScreen score that I talked about earlier. So communities that have that high pollution burden and a high population vulnerability are prioritized to be addressed by this program. So the program provides technical assistance to building owners, help with connecting with contractors, and we see strong workforce requirements here with the mandate to meet prevailing wage and skill and training levels for the contractors. And then we see a really helpful structure with how the incentives are put in place here. So we see separate incentives for measures that reduce owner costs and measures that reduce tenant costs. So this gets at what's called the split incentive problem in multifamily buildings, where for some costs, it will help reduce the tenant's energy costs, but the owner is paying for that measure, right? So there's a sort of a disconnect between who receives the benefit and who's paying. And here we have incentives specifically for measures that are going to reduce tenant costs, and there you see a higher incentive for those measures. So it's a way to really support building owners and taking on both kinds of interventions, with some of the in-unit interventions being the ones that will be most impactful for tenant energy burdens. So overall, I talked about how systemic and institutional racism and policies have really contributed to the current pattern of BIPOC and low-income communities facing disproportionately poor housing quality today. And that with building decarbonization, we have an opportunity to reduce building climate emissions and address housing quality if we do it right, with a really intentional idea to advance health equity. And we need to understand how we can invest public money to support these comprehensive upgrades and really reflect the community priorities in the way that the work is being done. So what's next for me? What I'm thinking about is, what financing and investments do we need for these comprehensive upgrades? So basically, what's it going to cost? Whenever I talk to policymakers, that's a lot of times what it comes down to. How much is this going to cost? So getting a better understanding of that. And then how can states use the Inflation Reduction Act money for comprehensive upgrades? So especially being able to pair with existing state and utility programs to kind of get the most out of the money and maximize that. And then what do these comprehensive upgrades look like across the country, right? And an upgrade in Los Angeles, California is going to look really different than an upgrade in Minneapolis, Minnesota, right? So we need to understand, for kind of different building typologies and different regions and climate zones, what the differences are that we need to address to achieve this kind of comprehensive upgrade. So we have a few research projects going on with our partners, and I'll related to these questions. So I'll look forward to sharing some of those results when we have them. And thank you very much. Happy to take questions.
Hello? Okay. Yeah, so on the last slide before the sort of next steps,
Yeah.
When it was showing those programs, I noticed that the incentives were sort of per metric ton of carbon dioxide equivalent rather than like per, retrofit type. So I was wondering like what your thoughts were on that, and if they did that because doing some weatherization change on like a super old building would have more like a greater carbon reduction impact, and the same thing on like a newer building.
Yes, so the program was targeted to kind of an energy efficiency as measured by greenhouse gas emissions, like the CO2 equivalents specifically. And the sort of cutoff was the measure has to achieve at least a 10% energy savings. And then once you meet that threshold, then the more energy you save, then the more the incentive is. So I think that's as you observed, that you can get a bigger benefit for buildings that are very old and energy efficient. And this also encourages kind of deeper retrofits as well. So you can think about, okay, just swapping out the lighting system, right, is going to have some energy efficiency. But if you combine that with the building envelope and more efficient appliances, like you will achieve greater savings, and you can access the higher incentives. We have a question.
Hi, thanks. This is Robbie Parks. Fantastic talk. Thank you. I just had one question based on what you said, and then another based on another exposure. So with regards to, temperature indoors, I'm sort of really interested in how, people who are energy insecure, I'd imagine, or I think the evidence shows that they're just having indoor warmer houses, right? So like in the summer, electricity costs money and they're just not using AC. And I was just wondering if you had any thoughts on like whether or not the energy uncertainty or the amount they spend is actually an underestimate, because they're not cooling their houses because they can't afford to. And then the other question really is, I mean, I do a lot of hurricane work, and I'm just curious, everyone's seen the images of Hurricane Ian, and like weatherization, I suppose, can take that form, like so the building materials, and like I just thought maybe you could speak to that a little bit and just say, what you thought about the idea of resilience for building materials, and also, where's the threshold where people just have to have a managed retreat? So thanks.
Yes, really great questions. Thank you for those. So the first one, is some of the energy burden estimates actually an underestimate because people aren't using their AC? Yes, definitely. That's what the data that we have shows, is that people who are already energy burdened would be even more so if they actually use their AC to keep their home at a comfortable temperature. So I think, two comments I would have on that in relation to building decarbonization is that one, replacing a furnace with a heat pump can have a benefit of adding cooling, efficient cooling, to a home that either didn't have cooling before or may have had a very old and inefficient AC. So I think that's a good potential opportunity to really increase the access to cooling with these building electrification upgrades, and that pairing that with whole building energy efficiency measures, so these kind of deep retrofits that I talked about, what we see is that it doesn't necessarily increase utility costs to add cooling where it wasn't there before. And that's particularly true if you can add on-site renewables like rooftop solar. That has a huge benefit for utility bills. And then the second question of, how much can building resilience kind of stand up to the face of some of this like extreme weather and natural disasters? It's a really good question. I think we have information on improvements that can be made to build the building materials that are used, the building design itself that can improve resilience. But I think it's also true that there's a limit to what the building design or materials can withstand, and that some areas that are prone to repeated flooding or repeated wildfires, that the building itself can't necessarily be resilient to those factors.
Thank you for a really nice talk, Veena. I was struck by how inefficient the New York City multifamily living is. And I think about it because having lived in apartment buildings, there's at least some energy efficiency of having shared wall space, right? And other components of that. But I do think that the classic New York City heating in the winter is an overheated apartment that you regulate by opening and closing the window. And I wonder how much of that, and that contributes, changes the indoor environment so much so that we look at dust mites, which cause allergy and asthma. You don't measure them in apartment buildings. They're too dry. But if you go to freestanding homes in Brooklyn and Queens, you start to measure dust mites. So it really does change the indoor environment quite a bit. And I wonder if some of that is part of the inefficiency, just that we can't, right? It's not individually tailored to each apartment.
Yes, I think this issue of the kind of overheating, where that's the goal, right? That's heated to the point where it can stay warm with the window open. This has come up and multiple times, like in thinking about New York City, and I think that is definitely a factor in how much energy multifamily buildings are using. On top of the fact that some of these are really quite old boiler systems. Both of those are huge contributing factors. So I think from just a simply like climate emission side, there's a huge opportunity, but it's going to take a big capital investment to move those buildings to to efficient heat pump systems and address the other building level factors to make them more energy efficient.
Thanks.
Hi, I'm Miss Pat, a doctoral student here, and I'm working with React on a gas to electric conversion pilot project, and a lot of that has been possible through the help of a very generous funder. So my questions are related to funding. The one is, if we were to study this large scale and want to see health impact, it would have to be the sample size would have to be huge, and that would require weatherizing a lot of units. And so I don't think that avenues through the NIH, for example, are really amenable to this kind of work. And I'm wondering whether you agree with that and what other opportunities could be pursued to evaluate that. And then the second is, you had this mention of like 50K weatherization needed. What does that cover?
Yes, so I'll take that question first. So that kind of 50K average was looking at the things like lead, asbestos, mold, a leaky roof. These are building level factors that prevent weatherization work from being done. So for example, in many weatherization programs, whether you're talking about like a utility level energy efficiency program or the weatherization assistance program, the federal program, a structural deficiency like a leaky roof means that the building is deferred from the program. It's not able to participate. So that's this sort of pre-weatherization barrier, right? Or the presence of is another one. Again, the building's deferred, it's not able to receive the weatherization. So it's those kinds of building factors that are resulting in buildings being deferred from weatherization programs that sort of pre-weatherization work would need to address. And then, your other question is, something I've been thinking about a lot, in the sense of we're going to need a big investment in the affordable sector if we want to have these comprehensive building upgrades done. So how can we talk about the benefits of those investments, the kind of return on investment? Because I'd say for better or worse, that's our sort of policy framework, right? It's the cost benefit analysis. So we really need to be able to speak to the benefits to support investment of public money. And I think the public health benefits is a very very kind of strong point in that. So the question is, how can we kind of quantify or speak to the evidence base on how some of these building interventions do provide public health benefits? And I would say for some of them, we have a super strong evidence base, like lead remediation, for example, right? Like there's lots of evidence, lots of economic analysis on that particular intervention. And there's, I'd say, a good amount on weatherization, but we really do need to kind of build out more of that evidence base. And yeah, I'm hopeful that through some of the programs that are being put in place, that we can start to get some of that data as buildings are upgraded, and see some of the benefits, if we can partner to do some of those studies, so that you're not having to pay for the cost of the upgrades, if that makes sense.
Thank you.
Just gonna stop sharing.
Nice photo of Robbie. Okay. Thank you, Veena. That was super interesting. Two questions. The first one, it seems like from my perspective, there's a supply side issue right now. It seems like there's a lot of money and a lot of people wanting to install efficiency upgrades and do these improvements, but it seems like there's very, very long wait times, especially when we start talking about large multifamily units. And so curious what, just, you know much more about this. So kind of where is that going? And I think this great opportunity for people from disadvantaged communities to be trained and actually move into this sector. So what kind of things are going on in that space? And then second, I'm really curious what you think about these kind of cumulative EJ scores, because you showed the Callan virus screen redlining results. But there's, especially when these EJ scores are tied to funds from policy to actually change things in communities, because, for example, Callan virus screen, the Tenderloin in San Francisco, it doesn't actually score very high and doesn't get funding. It scores really high on poor quality housing and a couple other factors, but because there are, I don't know, 16 factors or something in Callan virus screen, it doesn't actually end up achieving the threshold to receive funding. And so curious how you're thinking about that, especially when we're thinking about housing quality and kind of more, housing quality and what that means for these scores.
Thank you. So also two really great questions. So the sort of market availability, that part of the question. Yes, there's definitely supply chain issues related to heat pumps and other items needed for building electrification. This sector has not been immune to kind of the global supply chain issues. And one helpful thing that the administration did was actually authorized under the Defense Production Act specifically for heat pumps for the building sector. So that's a big kind of incentive for US manufacturing to ramp up on heat pumps. And the other thing I'll say about that is there's more work needed for multifamily buildings in particular to understand what's the best practices for electrification and how you install heat pumps, and because beyond the sort of pre-weatherization work, that I talked about, then for electrification itself, there's a lot more work that needs to be done, right? The increasing the electrical capacity of the building systems, these electrical panel upgrades. Sometimes you might even need beyond outside of the building, the utilities serving that building might need to upgrade its structure, right, in order for buildings to electrify. So there's a lot more sort of research and analysis that needs to be focused on the multifamily sector when it comes to electrification. And
so yeah.
Yes.
If you try and we're really didn't do anything about it, then exactly like said, like at the building level or even to the distribution.
Yes.
And the other day, like we talked about how with the pilot, the NIEHS pilot, that a lot of landlords wanted to do it, but the amount of money you paid to do the upgrades to the electrical system, it will cost prohibitive.
Yeah. Yeah, and to your other question about kind of these indexes and the utility, I very much agree with the challenge you highlighted, right? That when these indexes are used to kind of compare and then make policy decisions, you get the sort of question of scale, right, in these geographies where if you're thinking about within San Francisco, the Tenderloin certainly scores worse than the rest of the city, but compared to the rest of California, it doesn't fall, kind of within that range. So I haven't thought a lot about that particular question, so I'll leave it there with I think it's a challenge, and we need to have a better way to use the information in making policy decisions so that communities that need funding aren't left out of the process.
And as we're allocating money to these communities.
Yeah.
Wonderful talk. And you can see there's a lot of interest in this topic, and I appreciate your perspective. I guess kind of two bigger picture questions. I mean, this is, I think, obviously, very forward looking with the IRA. There's going to be a lot of jobs, money, attention. I mean, thinking about, we train MPH students. Do you have suggestions on how we can bolster their training for them to be more effective in participating in this work from different dimensions of it, right? Kind of more practice oriented. And then if you can just speak maybe a little bit to, so you talked about how quantifying public health impacts of some of these building decarbonization efforts is one big research need. And if there are others that, that you kind of see in terms of research needs. So I guess speaking to kind of training and research.
Yes, I'd say the sort of research gaps and needs that we're seeing consistently is around the questions of the non-energy benefits, what the term that's used in the sort of like climate and energy efficiency world, the non-energy or non-greenhouse gas benefits. I always kind of laugh at that. I'm like, you mean health, the whole thing I work on, but yes, the non-energy benefits. So I'd say really understanding the kind of full range of those, because there's been particular work done on like childhood asthma, for example, to say, but not necessarily on other subpopulations that could benefit, like people over 65 or pregnant people. So like really understanding the kind of full range of benefits on a variety of health outcomes of some of these different building level interventions, and in training of MPH students. I think I have two ideas on that. I think connecting students with groups that are actively engaged in the policy space for their sort of practicum or field study requirement is a really great way for students to get practical experience. So the more that universities can partner with those kinds of organizations will be really helpful to get that experience. And then maybe adding a specific component to the coursework that they're doing that focuses more on policy advocacy or translation.
Well, thank you very much for your presentation. The last slide you showed was looking at an investment per CO2 equivalent. That's a really, really, really difficult problem. And have they got a means or method that's been established to do that? So for example, if I replace my gas stove with an electric stove, I'm eliminating a major source of nitrous oxide, which has a CO2 equivalent much higher than that of CO2, 200 to 300 times. And then there's also the question of electrical grid. If I improve my electrical efficiency, but my electricity is being supplied by a nuclear reactor, that's very different than if it's being supplied by coal. So how are they dealing with that? How are they coming up and quantifying that? That's really, really hard. I'm just curious.
Yes, I agree with you. It is very challenging, and the way it's done is there's these sort of standardized programs that are used, they're software packages that are used by these energy efficiency programs. So the particular program I talked about, I mentioned that it provides technical assistance to the building owner. So there's these software packages that have been developed where you can feed in like the building characteristics, and then all of the different sort of relevant information about what the intervention is, and it'll calculate based on its program sort of analytical method what the CO2 equivalent would be. So I'd say that's the way it is being done. Are there improvements needed to how it's done? Absolutely. I think some of the factors you highlighted aren't necessarily included. And what we saw in our research on multifamily energy efficiency programs is that these software packages don't perform as well for multifamily buildings as single family buildings. So they're kind of systematically underestimating the benefits that certain interventions have on like energy use or CO2 equivalents for a multifamily compared to a single family building. So I think when we are looking at like from a strictly climate perspective, there's still improvements that are needed there, much less in terms of integrating some of the other benefits.
All right, any other questions online or in the room? Okay, well, if not, thank you so much.
Thank you all.
Jason.